Hello, my name is Laura Cook, and I'm currently a PGY3 at Orlando Health Emergency Medicine Program and a future sports medicine fellow at the University of Florida in Gainesville. I'm honored to share with you a collaborative study on serum biomarkers in concussed children and youth. I have no disclosures. To give a quick background, as emergency clinicians, we often see concussed patients in the department, many of whom were injured from a motor vehicle crash or a fall. I think we see concussed athletes less frequently because many of those players are referred straight to their sports medicine clinic. But there's also an in-between population, particularly those that are younger, who develop concussions from recreational activities. Concussions can significantly impact neurological function, and a lot of emphasis has been placed on concussion in the sporting community. But there are far more children and youth who participate in recreational activities, and they can confer considerable injury. I want to define what concussion is. It's a mild traumatic brain injury, typically diagnosed based on clinical findings and mechanism, and with the use of various screening tools. But there's been a substantial amount of research that has been done on neuronal biomarkers in identifying brain injury. Glial fibrillary acidic protein, which is an astroglial protein, and ubiquitin C1 terminal hydrolase L1, an axonal protein, have been found to be elevated in CSF and serum after traumatic brain injury. I'm going to refer to those as GFAP and UCHL1 from here. Previous studies have shown that the more severe injury correlates with higher levels of these biomarkers, and they also correlate with identifying injury on a CT scan and have been FDA approved for this as of 2018. The purpose of this study was to compare the levels of these two biomarkers, GFAP and UCHL1, in children and youth who have sustained concussion amongst three populations: a general trauma, such as those who were in a motor vehicle crash, an organized sports group, such as sports like football or soccer, and a recreational activities group, some activities which could include biking or skateboarding or even trampoline. This was a prospective study done at 3 level 1 trauma centers from the emergency department. Serum was drawn from the subjects who've been diagnosed by standard definition with concussion within 6 hours of their injury. All subjects had a GCS of 15. The GFAP and UCHL1 levels were measured using an ELISA assay. 131 children were enrolled in this study. A majority were male, and the mean ages of each group were 12, 14, and 12. GFAP and UCHL1 levels were highest in the recreational activities group. GFAP levels were significantly higher in the recreational activities group compared to the sports group, and UCHL1 levels were significantly higher in the recreational activities group compared to the general trauma group. You can see the median serum levels depicted in this graph. During this study, some of the patients had CT scans of the brain based on clinician discretion. And this graph shows that a higher percentage of the recreational activities group had positive CT scans. In conclusion, GFAP and UCHL1 serum levels in this study were the highest in the recreational activities group. This group also had the highest number of positive CT scans. So one can infer from this, based on prior studies of these biomarkers, that this group had the more severe brain injury. There's a lot of theories as to why this could be. I think many of these kids are likely playing around without supervision or without protective equipment, and may also lack proper training and skills to participate in some of these activities, and therefore they're at higher risk of injury. What I took away from this study was that we as providers in the emergency department need to be aware that those who develop concussion from these more routine activities can still confer significant injury, and they need to be managed appropriately with adequate symptom expectations and treatment, return precautions, and follow-up. As healthcare providers, if we have the opportunity to reach out to the community, we need to improve our preventative measures to decrease the incidence and severity of injury in this population. Thank you.